I would like to invite Dr. Kundu to initiate the plenary deliberations, providing perspectives on the developmental challenge in the SDGs context.
Mr. Dharmendra, the moderator for the session, Mr. Vijay Mahajan, Mr. Vikram Patel, colleagues and friends. It's an honor and privilege for me to associate myself with this Impact Conclave 2016. And I'm really grateful to the organizers for giving me this opportunity to talk to these distinguished delegates coming from different development sectors and also the sectors of social and human development. Given the vast canvas that Swapnil has very lucidly presented, what I would do is to restrict myself to a couple of issues largely concerned with measurement and upscaling. Let me walk you through not just billion dreams, but 7.3 billion dreams at the global level, and particularly 1.25 billion young dreams of India. Young, I said, because India has the great demographic dividend of having large percentage of population and workforce in 15 to 30 age group. Now, if you look at the concept note, it talks about inequality. Given the inequality that we have, particularly in the less developed countries, how do you really do impact assessment? Life cycle impact assessment to be done, given the fact that the benefits of a project or a program are not shared equally by different sections of population, persons belonging to different social and religious groups, persons belonging to different gender, and also across regions, particularly something which is emerging between rural and urban areas. How do you really measure your outcome indicators given such inequality? And that, I think, is a very critical area on which the concept note has drawn our attention to. I believe that at the global level, the best methodological exercise which has been done to bring in inequality in the impact assessment is the UNDP report, which from 1990 onwards is bringing out human development indices, 3 different dimensions: livelihood, basically the economic well-being, which captures livelihood, which I'm sure Vijay is going to talk about, is a major theme here; health, which includes, as Swapnil rightly pointed out, doesn't include always nutrition, but certainly nutrition should be linked with it and the relationship should be analyzed; and education, which of course includes skill development. So you can see that the major concerns of this conclave are reflected at the global level also. This UNDP from 2010 onwards in the impact assessment is bringing in inequality, explicitly into your measurement framework. It says that, well, if countries A and B have the same level of development, let's say same level of earning, same level of life expectancy, same average number of years in schools, the country which has higher inequality in access to different facilities must have a lower value. And that, I think, is a very, very important message. In our evaluation, whenever we look at the impact of a project and find inequalities, how can we design a specific weightage system to give special considerations to the marginalized, vulnerable sections of the population? What I think I would do is quickly just present you the analysis that I did on the basis of the this adjusted inequality, adjusted human development indices, and pick up the clues for impact assessment at the ground level. But before I do that, I think we are at a critical juncture, as Swapnil was mentioning. We are transitioning from Millennium Development Goals to Sustainable Development Goals. And I think it's the right opportunity to quickly look at how Just do we assess the impact of different policies and the programs that we have designed at the national level and the global level, and to what extent we have been able to achieve the 21 targets of the Millennium Development Goal. Just have a look at this nice way of capturing the success or the failure. The black line is giving us the targeted expected reduction in poverty. I'm just giving you the figures for India as an illustrative case. What you find that our success has been slightly higher than what was stipulated. If you take Tendulkar Committee's measurement exercise to be valid, we find that we have achieved the target of halving poverty much before 2015. Even in fact, by 2012, we have reached that target. And this is true not only for the poverty reduction of $1 a day, which has now been revised to 1.3235, but with other 4 targets also: drinking water, slum improvement, I will come to that little later, gender disparity in primary and secondary education. You do find, if you draw the assessment curves, you will find the non-linearity, of course, is there, but you do find that in these 4 targets, the performance of India, and as a whole Asia, I did a paper for Asian MDG targets, that is certainly meeting. But in the context of 17 other targets, you find your expected outcomes are much higher than what we have been able to achieve. I've just taken one as an illustrative case: under 5 mortality rate. In fact, our success rate is much less than what it is. Now, why is it that development deficits are occurring? Basically because of inequality across regions, across gender, across social and religious groups. When I analyzed as a part of the post-Sachar evaluation committee, in fact, the discrimination and disparity across social religious groups really appear as starkly important. We have been able to make some reduction as far as the gender inequality is concerned. Even interstate inequalities show from 2003-04 some reduction. Bihar, Uttar Pradesh, Jharkhand, Chhattisgarh making higher growth rate in terms of economic and social dimensions than the national average. But rural-urban inequality is something which emerges starkly important even within the backward states and the developed states. What I did, just to focus on the inequality and to bring that into the measurement framework, I looked at the indices which has been brought out by Human Development Report. I classified all the countries into 3 categories. 1, highly developed and developed countries. 2nd, the countries at the medium level of human development. 3rd, the countries at the lower level of human development. And I plotted the inequality figures through which UNDP has made the adjustment. Just have I just wanted to show quickly the rural-urban differentials in infant mortality rate, which is very high, and you do find a strong correlation with per capita income. So rural-urban inequality, as I said, it emerges as the most significant explanatory variable of inequality. Similarly, this is the child mortality rate. This is under 5 mortality rate. Again, I tried to look at the relationship with urbanization. And this is interesting that if you look at income poverty or consumption expenditure poverty, you find that levels are not that high, but the moment you take multidimensional poverty, wherein you bring in the other dimensions of social dimensions of development, you do find the inequalities, the poverty figures are much higher. And what is important is the countries in Asia, including India, report much higher multidimensional poverty compared to the economic poverty, which really means that our development deficits in the dimensions of social and human development are much higher, and that's true for a large number of Asian countries. I'll just quickly present the analysis that I did with the UNDP's inequality adjustment figures, and I would conclude at that by discussing their implications for impact assessment. Just look at this graph. What I did, I took about 94 countries which are at the high level of human development, and the red dots are showing inequality in income, or this is really reflecting the livelihood inequalities in the most developed countries, and the blue ones are showing the inequality in access to education, and the green dots are showing the inequality in the access to health facilities. Clearly, the income inequalities work out to be 30%. I'll give you a table which summarizes, whereas health and educational inequalities, particularly health inequalities, are much less. This is I did for 3 years, 2011, 2013, and 2014. The pattern is more or less the same. This is this same set of countries analyzed over 3 points of time, taking the latest data from the UNDP report. Let me once again say that these are just inequality in income dimension, educational dimension, and health dimension. The countries on the x-axis have been arranged in terms of their levels of human development. Now we go to the second set of countries, which is the countries reporting medium level of human development. You find that educational inequalities are coming up, but still income inequalities are very high. These are the inequalities within the countries. These are the income inequality, educational inequality, and health inequalities within the countries. Generally, one would say that although in the developed countries, income inequality is high, access to education, which school my children will go, is not that much dependent on your income level. There are various programs through which that inequality can be curtailed. Similarly, which hospital you go, it also doesn't, is the disparities is not as high as the income disparity in the developed countries. As I said, in the medium level countries, this is the picture at 2 points of time. But what is important to see is what's happening to the inequality within the less developed countries. India figures somewhere here. You do find that educational inequality and health inequality at the lower level of human development is much higher compared to the income inequality. Basically, the inequality in access to education is not explained only in terms of income inequality, but your social network, all that really augments the health inequality and inequality in access to educational institutions. This is an exercise which I did for UNDP before a few months, and this picture emerges with the latest data. This is an analysis done by taking the states as the units of analysis. This is done by Surya Narayana of IGIDR in Mumbai. And I think what emerges is very interesting. The blue ones are the educational inequality, which are much higher compared to even the health inequalities, and income inequality is very low. Basically, he admits, and we discussed it, within the state he has not been able to capture the inequality properly, but even if you do that, the educational and health inequalities tend to be very high. This is a table which summarizes. You find that the developed countries take life expectancy, the inequality is, average is 8.12. You do find that inequalities are much higher as you come down to the least developed countries. It is 35% in education, 33% in life expectancy. Income inequality is less than that, and India certainly shows a similar alarming picture. I would just like to conclude by mentioning 1 or 2 points. Basically, that in designing your programs, implementing them, monitoring them, I think it's extremely important that we look at the impact across different social and economic groups. I didn't want to bring in a lot of graphs to show you how the inequality in social religious dimensions have not really gone down, although in gender dimension, there's a marginal decline, which is certainly much less than, satisfactory considering the high level of gender inequality that exists. But as I mentioned, that rural-urban inequality is something which is very significant. In fact, life expectancy in the rural areas, if you look at the NFHS data from Mumbai, it shows that the rural areas have at least 9 years of, life expectancy deficit compared to the million-plus cities. Given all that inequality that exists in the million-plus cities, still the rural life expectancy is 9 years short than the urban areas. And there's a study by Krishna in the Duke University which brings out with the latest data that if someone had or her entire education in the rural areas, the possibility that the student will make it to IITs or IIMs or any of these, institutions which give you access to the global jobs is almost zero. I just want to conclude by mentioning another important point. You see, look at this rural-urban gap in sanitation. In India, the gaps are very high, and that's why I'm very pleased that the present government has focused on water supply and sanitation mission, and particularly giving emphasis to the rural areas. Also, what is surprising is that South Asia reports the highest rural-urban gap in sanitation facilities, along with the Latin American countries in the base year. But in the latest data that I could get, I find that the South Asian inequality in rural-urban access to sanitation facilities is even higher than any other region, and India is certainly standing out in this. Now, given such sharp inequalities in India between rural and urban areas, in income dimension, yes, but in health and educational dimension, the inequalities are much more serious. You would expect people to migrate out. But if you look at the urbanization data, you do find there is exclusionary urbanization. The growth rate has significantly gone down from 3.9% in the 70s to 3.1%, and now it is stagnating around 2.7%. And what has happened in slum population? India has been talking about it, that our success in reducing the slum population is the highest, and UN Habitat is also complementing India and many other South Asian countries. But what is surprising is reduction in slum population is the highest, although the rural-urban inequality is very high. This is basically because of the exclusionary urbanization. I do not know whether you were aware that slum population was projected by Pranav Sen committee to be something like 95 million by 2011. It was only 64 million. It was projected to be 93 million, but actual data shows that it has remained at 64, 65 million. Basically, I'm saying that the rural-urban inequality aspect, whenever you're designing a project, monitoring it and evaluating the impact, I think one has to take these serious inequalities which exist, and that I thought was the key concern, one of the key concerns